Right, second video for today. In collecting my thoughts a little bit so I can try and get this as quickly and as informatively on camera as I can. Right, yesterday with the full seminars, drug usage and so on, I personally found myself focusing more on the long-term health effects. I found that a lot more sort of a relevant point to this whole process, and probably something that a lot of you guys are wondering, are you going to have kidney issues later down the line? Are you going to have liver issues? Are there any other side effects or potential issues that you're not completely aware of? I thought it was really discussed in quite a very informative way. A lot of science was involved, and basically this is the kind of gist I got from that was, yes, with more potent forms of steroids like tren especially, and high level of toxicity substances, normally found in orals, but there are some injectables out there that are very, very strong compounds, and obviously the stronger the compound, the more of a struggle your body is going to have going through that compound without any damage whatsoever. So my advice to you in terms of toxicity content is it cannot hurt to have your blood work done, guys. It really can't. You can get it done at your GP. You don't have to tell them what it's for, but you can just inquire that you want a standardized blood test and so on, and you can arrange out through your GP. There's certain tests out there online that you can purchase. I've just been made aware of one in particular, but I need to find out about a bit more to put the brand out there, which is a very comprehensive test that comes with 3 tests. It's between £70 and £100, and it goes a lot in depth. The way I look at it, if you're willing to give your car an MOT, why not check your health? It can't hurt. It's not gonna affect anything. It's not gonna knock you off it. If you're scared of needles, then why are you doing a gear in the first place? So yeah, definitely just reduce the risk by going to have that checked out. They did bring up a very good point of long-term brain effect of strong and intermediate cycles. Now, the research they found so far is that yes, there obviously is a knock-on effect in certain parts of the brain, whether it be the grey matter, the white matter, the overall wall of the cell tissue of the brain, and further on down the line where it'll affect sort of your central nervous system and so on. All that being said, in terms of health concerns and safety issues, obviously you reduce that drastically by taking safety measures in terms of having your blood work done, having your blood pressure checked every so often, doing mild dosages. Anyone who's doing over 1 ml or 2 ml of most compounds for their first cycle, you're off your head. You're not going to get the same level from 4 ml, 5 ml compared to what you'd get off 1 or 2. When you first start using, your receptors to that compound aren't going to be that effective. You will probably, if you're lucky, use 20, maybe 30% of that drugs you're putting in you, if you're lucky. That's why it's so important you come off that substance, not only to give yourself a break and for you to reevaluate how your life has been while on it, but also once you do decide to go back on it, if you do decide to go back on it, then the sensors that you've been overloading with the drugs, they've had that break, and when you reuse the substances, that those sensors are actually more able to use more of the drugs. That's why guys who've been doing it 20, 30 years, they can probably still get better results than you can doing 12 mil by them just doing 1 or 2 mil. And obviously their prolonged health is going to be a lot better. So my personal advice would be, start small. Do your research, do your homework. Make it as safe as possible. You know, you want to enjoy it, then fine, enjoy it and enjoy it healthily. But don't just start slamming it in and that and thinking it's going to get you better results quicker and all the rest of it. Yeah, partially it may do, but if it kills you in like 5 to 10 years down the line, or you know, really affects your life or your job or whatever, is it worth it? Is it really worth getting there maybe a year or two quicker and drastically having a reduced life or, you know, quality of life, or just taking your time, learn yourself, learn your body, and then have a lot longer where you can enjoy the effects that you work so hard for? In my opinion, it makes complete sense just to start off low, gradually use and do your homework. This video is dragging on a bit, guys, but I think it's a really important message to get across. I know it's not a case of one size fits all either. There's going to be guys out there with exceptionally high tolerances to certain compounds or all compounds or whatever, but just because they do doesn't mean you do. We all have genetic gifts. Some people are genetically gifted that they got very high tolerance levels. Other people have genetic gifts that they can have the most smallest amount of gear and their results are just drastic. They're huge. There's other guys who are genetically gifted that they can take themselves a lot far, you know, take their training and their body to a lot further extent, naturally, than 90% of the population. It's all a case of giving yourself enough time to learn yourself and let your body make that decision for you, but listen to your body, listen to what it's trying to tell you. Alright guys, there'll probably be at least one more video coming up in a little bit. Really would appreciate some feedback on what you generally feel like this video is getting across. And yeah, catch you guys in a bit.